Exactly.
So I'll by giving us yet another brief of what we discussed in the previous lecture, and we will, after us being able to look at some of the strategies of health, preventing disease and health promotion, we went through the different steps involved in a needs assessment, and we were able to look at majority of the steps that an individual must take if they are to continue doing a needs assessment. But also we discussed why there is need for doing a needs assessment in a community. And I think from that particular lecture, we now can be able to do our needs assessment in the community, and we shall be able to come up with better results. But also, you remember, as part of your steps in doing a needs assessment, you will need to do what we call a monitoring and evaluation. But before we go to understand deeper some of the key principles involved in monitoring and evaluation, it was also key that we looked at social marketing as a way of as a strategy in trying to promote health, but also as a means of improving health communication in our community. And today, what mainly I want us to focus on is we're going to go a little, we're going to do something a little about social marketing, because the last time we did it, we were just able to look at we are only able to look at its definition somehow. But today I want us to have a dive into social marketing, but also how some applications can be, some of the applications of social marketing, or some of those principles of social marketing that we can be able to apply in our work as a reproductive health specialists or as public health specialists, how we can actually use this aspect of social marketing in trying to develop better ways to improve health, but also better ways of trying to communicate to our population issues regarding health. And let me just be able to share with you uh, the screen here that we can be able to have. You can be able to understand possibly what I am talking about. So I hope in the beginning of of this module, we had a question on how we should be able to differentiate health communication, health promotion, and health education. I think thus far we should now be able to have a difference between all those concepts, because we have been able to go through all those concepts at once. So you should be at the background of your mind up to this stage when we are summarizing this particular course module. We should be able to understand those key concepts, and we should be able to clearly differentiate between them. Yes, so that is what I want us to cover today. It is just an addition of what we covered the other time, social marketing as a health communication strategy. So today I just want us to use a few of these slides to furthermore be able to understand some of the concepts of social marketing. So from the definition there, we are saying that social marketing is the use of commercial marketing techniques to influence behavior that benefits individuals and society as a whole. So in other words, in social marketing, we're looking at an influence that is positive to the community. And in healthcare, Social marketing aims to encourage behavior that leads to improved health outcomes for individuals and the community. So, in trying to improve reproductive health access or access to either information or services of reproductive health, we use social marketing to make sure that the behaviors are positive uh, among our community. And there are mainly about 4 strategies that can be used in social marketing in healthcare, but also in this regard, we're looking at reproductive health. So, social marketers, the first strategy is audience segmentation. So, social marketers divide the target audience into smaller groups based on common characteristics or behavior patterns. This helps to tailor the message and communication channels to the specific needs and preferences of each group. So, that first strategy is that you should be able to divide your target group based on their characteristics. Yes, women is a target group, but to divide them into smaller groups, you would look at women with disability, you'd look at pregnant women, you'd look at women of reproductive age, you'd look at women or females that are teenagers, you'll look at females that live in urban areas, or you will differentiate them or divide them by women with a particular income level, women with a particular education level. So those are some of the characteristics or demographic features that you can use to differentiate your target audience into smaller characteristics. You would also want to, if reproductive women of reproductive age were still your target group, you could further go ahead to dissect them into school going or non-school going, or married or unmarried. And these kind of divisions can help you tailor the kind of message or the communication channel you can decide to use. So uh, you will not use a specific kind of channel for women who are out of school. You may not have to write down placards, or you may not have to give them books, giving them information through books. If you give them through books, then they may use them for making fire, or they may use them in their toilets, because so you will have to choose the cultural backgrounds. You have to take the kind of behavior if you're going to. So this is a process of gathering information to inform the development of the social marketing campaign. It involves collecting data on the target audience, their attitudes, beliefs, and behaviors, as well as the barriers and facilitators to behavior. So this is more of a needs assessment also. So you will have to understand what is your target audience, but also what are their beliefs. What do if your target audience is pregnant women, you will need to understand what are their beliefs, what are their attitudes, but also what are their behaviors. You might realize that their attitude is that if you're pregnant, you do not expose, or you don't go and do your test if you're 1 week pregnant. And that is why we have in Africa the possibility that we may not achieve a lot of first trimester cases. Expect that the woman can go for antenatal care in the first 12 weeks of pregnancy. But if they do not go in the first 12 weeks of pregnancy, then you realize that they have delayed their first antenatal visit. And we realize that in many of our African settings, but also in many of our health facilities, to get first trimester, you may need to out of 100 women, you could possibly get about 15 to 13 of them uh, for their first trimester. And this is just partly because of such belief that you do not declare your pregnancy at an early stage. So if you're able to understand these kinds of attitude, these kinds of belief, then you can be able to develop a very strategic social marketing strategy, but also a health promoting message for your community. Uh, the third marketing strategy is what we call message development. Let me just highlight it here. So in message development, we're looking at social marketing messages should be clear, concise, and precise, and compelling, and they should resonate with the target audience. So if you're developing your message, it should be clear, but also it should be concise, meaning it should be on point, straight to the point, and compelling, and resonate with the target audience. For example, end teenage pregnancy. That is a statement that is concise and clear. But if you keep writing statements such as if you have sex, or if you're like this, you're going to get pregnant, and yet you're a teenager, your message may not be that clear, and it may also not be that concise. So when you're developing your kind of message, it should be that concise. And when we're talking about resonating with the target group, you need to understand your target group. You cannot go and give these messages of teenage pregnancy to women who are already married, who are already pregnant. You might be wanting to target their children, but the best target group would be school-going girls, and your audience place could be in these schools, or in any other place that may be attracting more teenagers. So it is important. So they should be framed in a way that emphasizes the benefits of behavior change and address the barriers to change. So your message should directly target how these behavior changes can benefit these individuals that you're communicating to. So if you're designing a message, and the message is it, it has no benefit of the behavior change, people may start to question what kind of information, or what are the advantages of changing their behavior. There is no way you can go and preach information of health promotion to a tobacco, to a smoker, and you don't have advantages of quitting smoking. You should be able to have such. And if you're able to put this, you could also include for them how they can address the barriers to change. And this kind of information can then help them readjust accordingly. Now, the fourth communication channel, I mean the fourth strategic, the strategy in social marketing is what we call communication channels. And social marketing messages can be disseminated through a variety of channels, including mass media. There we're talking about the televisions, the radio, the print media, the newspapers. But also we can use interpersonal communications such as peer education, patient provider communication, and new media such as the social media and the websites. These are key channels, but remember you have to choose them according to your target group. So, the the fifth is implementation. And you realize that this involves putting the social marketing campaign into action, including the dissemination of messages through various channels and the provision of support for behavior change. So, uh, after you've done all these strategies, you've had your audience segmented, you've done the research about them, you've developed your information, you've chosen your communication channels, you will have to now implement this activity. And it includes this dissemination of messages through various channels, including to the people, either the ones who are smoking or the ones who are not smoking, that you need to quit smoking. But sometimes, if you realize that individuals who have over smoked, they may have a tendency of just giving up, and therefore they will say, since my lung is now this black, let me just wait for my death by continuing to smoke. Usuals to change. But what roughly the different organizations have adopted is that they also offer information of hope. That whereas you're smoking, uh, if you quit smoking for just an hour, your lung or your liver would be restarting to detoxify your body. So the more you quit smoking, the better your health improves. Another physical activity, another example of a social marketing activity is physical activity campaigns. And these campaigns aim to encourage people to engage in regular physical activity. They may involve promoting the benefits of physical activity, such as improved health and well-being, and addressing uh, such common barriers such as lack of time and access to facilities. So most times, what individuals do is that they are able to offer people how they should be able to create time to be able to be able to achieve some of the physical activity plans. So if someone draws a plan, most times the barrier is that people don't have enough time, people don't have access to these facilities. So what individuals most times do is that they try their level best to try and draw for you a plan so that if you follow it, you can be able to achieve some of these physical activity plans. And then another example of a social marketing activity is healthy eating campaigns. These campaigns aim to promote healthy eating habits and prevent obesity and other diet related health problems. They may involve promoting the benefits of healthy eating, such as improved energy and mood, and providing information on healthy food choices and portion sizes. And in conclusion, to this particular issue is that social marketing is a powerful tool for promoting healthy behaviors and improving health outcomes. Effective social marketing campaigns are based on audience segmentation, formative research, message development, communication channel implementation, and monitoring and evaluation, as I earlier stated. So if you're able to understand these about six strategies through which you can implement a social marketing strategy in health promotion, and then your activities will uh, be very effective in trying to change behavior of individuals. So that is that with social marketing, and I would want to us to go into now monitoring and evaluation of healthcare or of reproductive health promotion and communication. So if we have any questions regarding that strategy of social marketing in health promotion, you can actually ask them. However, if we do not have, we can now go into healthcare monitoring and evaluation. Yes, Thomas.
Yes, thank you. I think my question is related to the multicultural setting. Sometimes